Okay, let's discuss hemostasis, the process of stopping blood loss when you have an injured blood vessel. Okay. So hemostasis. Okay. So here if you have, say, this is your blood vessel. All right, blood vessel here. Something happens to break it open, you have blood loss. Okay. You must try to plug that hole. That's what hemostasis is, trying to stop blood from leaving the blood vessel. And it's a three-step process, 3 steps to hemostasis. First one is called vascular spasm. Okay, so in this one, what happens is, here's your blood vessel. It breaks open. Okay. When it breaks open, the smooth muscles inside the wall of the blood vessel, these smooth muscles there, they will respond by contracting. So one is smooth, what's called your vascular smooth muscles, cells, contract, okay, just from the pain reflex, as well as the injured cells here, what's called your endothelial cells. These cells also will release chemicals. And those, both the pain and the chemicals released by the endothelial cells will cause the blood vessel, the muscles to squeeze. So what you get here is something like this. Okay, where the injury is here and the blood vessels are clamped down like this to reduce blood flow into the injured area. That's called your vascular spasm. Chemicals released by the injured cells, as well as pain reflexes, will cause the muscle layer of the blood vessel to clamp down to reduce blood flow into the injured area. Also, another step is what's called a platelet plug. So here again, the blood vessel is broken. And when it's broken, your collagen fibers, these are collagen fibers, which are in the blood vessel wall, they become exposed, and the collagen fibers then will attract platelets. To the area, okay? So in this step, your collagen fibers attracts platelets, which in turn release chemicals to attract more platelets, which attract more platelets. And before you know it, within minutes, less than 2 minutes or so, you have a big plug there. Just plug in the hole that blood cannot get out. That's your platelet plug formation. Now, if it's a small blood vessel, it's okay. This is probably enough to fix the problem. But in some cases, you need to have a more robust response where you have to kind of make this a bit more permanent. That's called forming a clot, a blood clot. Okay, so that's the third step there, or we call coagulation. So in the third part of the 3-step process, step C, is your coagulation. That's forming a fibrin clot. So here, again, blood vessel is injured. This is a blood vessel. All right. This part here in here is the lumen of the blood vessel. You may have injury to the inside alone. So if you have an injury only to the inside of the blood vessel, that injury will trigger what's called an intrinsic pathway. If the injury is to the outside only, it triggers what's called an extrinsic pathway. So you have 2 pathways. And most times the injury is across, like this. So in that case, both pathways are activated if it's fully across the wall of the blood vessel. But you have what's called an intrinsic pathway for when the inside of the blood vessel is compromised, an extrinsic pathway for when the outside is compromised. All right. So either way, these pathways converge. So in forming the blood clot, you have the extrinsic pathway and the intrinsic pathway. Okay. The extrinsic pathway forms something called a tissue factor. Tissue factor. This one forms something called a platelet factor 3. Both of these eventually, through various cascades of signaling, will eventually make something called Thrombin Activator. Okay? And then that Thrombin Activator its job is to convert prothrombin, which is made by the liver again, hang out it's also a plasma protein that I didn't discuss. This one, it converts prothrombin to thrombin, okay? And then thrombin, let's go over here. Then thrombin, its job is to convert fibrinogen. Convert fibrinogen to fibrin. And then fibrin is the string or the strings that can, again, if this is your plug of platelets here, okay, fibrin are the strings that come around like this to kind of hold it together better. That's fibrin. Its job is to hold the plug together for a longer period, and then after a while, the blood clot is dissolved by plasmin. Okay. Plasmin dissolves the clot eventually. So that's a three-step process to forming the blood clot. 1, clamp down. 2, get some platelets involved, and then 3, tie together with fibrin strands there. Now, this process can be, a problem sometimes if you have some conditions that may interrupt the pathway to get to these 3 steps. So one common, it used to be a very common condition that affected your blood clotting is called hemophilia. So hemophilia, okay, mostly it's a male thing. It comes in 3 versions. You have type A hemophilia. Here, you're missing, I think, a clotting factor 8 is missing for type A hemophilia. It's pretty common. Around 77% of cases is type A hemophilia, mostly males. Type B, also mostly males. Here you're missing factor 9, males again. And then type C hemophilia, here you're missing factor 11. That's missing. That one is not so male dominated in that case. And to treat this condition, so if you're missing these factors, then somewhere here you have interrupted the pathway to get to your prothrombin activator. And if that's affected, then you can't make thrombin. And if you can't make thrombin, you can't make fibrin. Okay, so these interrupt the cascade of events required to form your fibrin clots at the end of the whole system. And the way you treat hemophilia is really just to give you the shot. Actually put the factor in your blood. The missing factor gets pushed into your blood, so you can use it to address these concerns there. Use it to fix where the missing factor belongs. Another thing that can happen as well in your blood vessel is what's called a thrombus or embolus. So here is a blood vessel. This blood vessel, sometimes for some reason a clot forms. inside an unbroken blood vessel. So that clot is called a thrombus. Okay? Then sometimes it gets dislodged. So then it starts to move. So a moving clot, we refer to that as called an embolus. And then downstream, that clot may block blood vessels. So that, as the blood vessel narrows, then it may block it. That's called an embolus. Sorry, an embolism. Okay? It's just something happens abnormally, and it can lead to some severe complications downstream if you block blood flow from getting down to the distant targets. Okay, we'll stop there. Also, you should learn a little bit about anemia, anemia, what causes it. Also thalassemia and sickle cell anemia. Learn about those in terms of causal factors, population that it tends to target, and what the effects are. Okay.